Have you ever wondered how your brain controls everything from memory to emotions? What happens when something goes wrong in the brain? And who are the experts that help us understand these mysteries? Meet the neuropsychologist, a fascinating profession at the intersection of psychology and neuroscience. In today's video, we're diving deep into what neuropsychologists do, how they help people, and why their work is so important. Your brain is the most complex organ in your body, responsible for everything from thinking and feeling to moving and remembering. But what happens when the brain is injured or isn't functioning properly? This is where neuropsychologists come in. They study how brain structure and function impact behavior, emotions, and cognition. Whether it's helping patients recover from brain injuries, understanding mental disorders, or advancing research on brain function, neuropsychologists play a crucial role in the field of neuroscience. What does a neuropsychologist do? Neuropsychologists are experts in brain behavior relationships. They assess, diagnose, and treat cognitive and psychological conditions related to brain function. Some of their key responsibilities include cognitive assessments. They conduct specialized tests to evaluate memory, attention, problem-solving, skills, and language abilities. Diagnosis of neurological disorders. They help identify conditions like Alzheimer's, traumatic brain injuries, strokes, and even learning disabilities. Treatment and rehabilitation. They develop treatment plans to help patients regain lost cognitive skills or learn new ways to cope with brain-related challenges. Research and advancements. Many neuropsychologists work in research, studying how brain damage affects behavior, and developing new therapies for neurological disorders. Where do neuropsychologists work? Neuropsychologists work in various settings, including hospitals and medical centers, rehabilitation clinics, research institutions, universities and academic settings, private practice. Their work is crucial in fields like neurology, psychiatry, and even education, helping individuals understand and improve their cognitive health. How do you become a neuropsychologist? Interested in becoming a neuropsychologist? Here's the typical path. Earn a bachelor's degree, usually in psychology, neuroscience, or a related field. Complete a master's or doctoral degree, a PhD or PsyD in neuropsychology or clinical psychology is required. Gain clinical training. Supervised internships and postdoctoral fellowships provide hands-on experience. Obtain licensure. Practicing neuropsychologists need to be licensed, which involves passing exams and meeting state requirements. Continue learning. The brain is an ever-evolving field of study, so ongoing research and education are essential. Why is neuropsychology important? The work of neuropsychologists has far-reaching implications. They help patients recover from brain injuries by identifying areas of impairment and creating treatment strategies. Diagnose and manage neurological disorders to improve quality of life. Advance brain research to better understand conditions like dementia, ADHD, and mental health disorders. Improve mental health care by linking brain function with emotions and behavior. Neuropsychology is an exciting field that bridges the gap between the brain and behavior. Whether you're interested in a career in neuropsychology or just fascinated by how the brain works, understanding this field can give you valuable insights into human cognition and mental health. What part of neuropsychology interests you the most? Let me know in the comments. And if you found this video informative, don't forget to like, subscribe, and hit the notification bell for more content on psychology and neuroscience. Thanks for watching, and I'll see you in the next one.